thank you all for being here today. There are so many different levers that we as employers utilize to be able to influence healthcare at our organizations, and we're all going to touch on different ones as Alice has introduced. And I'm going to talk about how we have really focused on consumerism and how we focus on helping our team members make better decisions around their healthcare, and specifically how we do that by utilizing health savings accounts. A little bit about Wells Fargo. We are one of America's largest private employers. We offer health insurance to 99% of our team members, so to all of our full-time and part-time team members. And so under that, we offer health benefits to about 515,000 Americans between our team members and their families. This is a big investment for us. It's several $1 billion a year. And within that, we cover about 75% of the healthcare premiums for our team members. This focus is because we really want our team members to be able to be their best, whether that's at home or at work or in their communities. And to be able to do that, you really need to have your health as a key enabler. So when we think about our approach to our benefits and specifically to healthcare, we really think about that as being a shared responsibility between us and the employer and our team members. So for our team members, it's really about how do they make those best choices on how to spend their healthcare dollars and keep their expenses low. And then for us as the employer, we need to make sure that we put a system in place that has the right structures and tools and education that allow them to have that information to make those good choices. So we've really designed our health plans around optimizing for a really diverse workforce. We have 274,000 team members, and they span every aspect of needing different aspects of healthcare. So different coverage, they have different risk profiles, we have different income levels at our company, and so we really have focused designing our plans around giving our team members choice that's going to work for them. We have 3 different account-based plans. One health reimbursement account, it's a gold level account, and that plan is really designed to offer additional protections for people who are looking for that higher risk protection and protection for folks who may be in those lower income levels. And then we offer 2 health savings account-based plans. One's a gold level and one is a silver level plan. And those are the ones that I'm going to spend most of my time talking about today. With this focus, we've really been able to drive some very good outcomes for our company and for our team members. First of all, we've been able to maintain being able to provide very competitive plans, and at the same time continue to add coverage. So these are not kind of bare bones plans at all. As I mentioned, these are gold and silver plans, and we've also been able to add coverage for things like bariatric surgery, transgender reassignment, autism programs over time. So we're continuing to add to that coverage. We've also been able over the last 6 years really to be able to keep our growth in health spending lower than the national average, because as we all know, healthcare costs continue to go up, and we need to make sure that we are continuing underneath that trend, and we've been able to do that. And then specifically focused in on our team members, over the last 6 years, we've been able to keep their average growth in premiums to 1% over those last 6 years on an annual basis. So we're really proud of that and being able to keep healthcare very affordable for our team members. So I'm going to focus primarily on the HSAs today, since that was the request for our focus in focusing on consumerism. Just a quick refresher. I know most people in this room are very familiar with HSAs, but HSAs is an account where an individual can put aside money on a tax-free basis. They can put aside their own dollars, but also employers can put dollars aside in those accounts as well to be used for health care either now or in the future. They're portable, so people can keep them with them, and they're also owned by that individual, and that's a really key distinction with that HSA. We really like this model, and the reason why we offer 2 different HSA accounts is because we really like to think of it as that long-term way of financing healthcare for those people who choose it. if you think about it as that complement longer term for people who want to complement their Medicare, similar to how the 401k has really become that complement to Social Security, and really be able to think about how are you going to finance healthcare over time. People are really attracted to these. So in our company, 50% of our team members are using that HRA model, and we now have 40% of our team members who are choosing one of our HSAs. But here's the thing with an HSA that we think is super important. In order to have an HSA, you have to also have it paired with a high deductible health plan. And so we want to be really careful about that, right? Because if somebody has a high deductible, they're paying for their health care up to that amount of the deductible. And so that's where the shared responsibility for us as an employer comes in. We need to surround that HSA with those tools for success for our team members to make sure that they have what they need to make those good consumer-based health decisions. So how do we do that at Wells Fargo? First of all, we're really focused in on our well-being incentives. So we have a well-being program that allows each of our team members to earn up to $800 a year that we then place into that HSA account. And in addition, their spouse or domestic partner can also earn up to $800 a year to put into that HSA account. And then they can use that towards their out-of-pocket costs. Secondly, we need to make sure that we let our team members know how much they're going to pay for services and give them that transparency into the cost of healthcare. That's been really hard to do in this country, but there's been great strides in that in the last few years and a lot of innovation in this space. And so we offer a transparency tool so that our team members, if they're getting a procedure done or they're going to get some lab work done, that they can see very easily if they go to facility A versus facility B, what's that cost going to be for them? And we've seen great variations between facilities for very similar procedures being done. And now our team members can see that and make that decision for themselves, how much they want to pay for that similar care. And then finally, we need to make sure that our team members have a lot of choice in where they get their care and understand the price points for that. So if I'm not feeling well today and I want to go see my primary care doctor, or if I want to walk into a retail clinic, or if I want to go to urgent care, or if I simply want to sit on the couch at home and use my mobile device to go and via telemedicine see a doctor, I want to make sure that we as an employer offer all of those choices to our team members and all of those price points to allow them to make those decisions. So those are all parts that we as an employer invest in to make sure that those are available so we can have those choices available. So the key point that I'd like you to take away is that offering an HSA as a choice, we believe is a really good thing, but we need to surround it with that infrastructure to allow for those good decisions. So what we've seen in our experience in this space is that our team members are using the HSA. We've seen the usage double in the last 6 years, and our team members are also contributing to their HSAs. So in addition to the money that we contribute as Wells Fargo through the wellness accounts, about 70% of our team members are putting their own money into the HSAs, and that amount has been steadily growing over the years. Secondly, really important point, their care has continued. I think anytime you use a high deductible health plan, there's the concern, well, will people just avoid going to get the care that they need? And so we've done a lot of study of our team members here and really dug into our data to see what their behaviors are in this space, and it's been extremely encouraging. What we've found is that our team members who utilize the HSA get significantly more preventative care than those who do not use the HSA. So they are seeing their doctors. They are also getting far more preventative screenings. They have lower emergency room usage than those who do not use the HSA, lower prescription usage, and overall lower costs. So we are seeing very good behaviors in this space through the use of better consumerism. And then finally, we're also seeing that our team members who utilize the HSA are far more engaged in those well-being activities, and that's good on two fronts. One is they're earning their well-being dollars, and second, they are engaging in those lifelong healthy habits of getting their screenings, of doing the positive activities, of getting in motion and doing the things that are going to lead them to either maintain their positive health status or make that even better over time. So that's been our experience with using HSAs. Clearly, as we heard from Dr. Burgess, there's a lot of conversation about additional ways of improving those, and perhaps we'll get to some of that as we get to the question and answer session.